So Dr. Viscardi and her colleague sort of built upon a previous sort of link of uroplasma infections in the mothers and prematurity birth, and then also long-term consequences of these kids, whether or not they have prematurity birth leading towards bronchopulmonary dysplasia or increasing oxygen use or frequent doctor's visit. In this study, she actually studied more than 100 infants who were roughly around 6 months. And then they split the group into two groups where half the group received 3 days of azithromycin therapy. For the purpose of the azithromycin therapy was to see if treatment of uroplasma infection could decrease the long-term consequences. And by long-term consequences, they looked at 6 months of age and then 12 months of age and see whether or not there was a higher incidence of BPD, bronchopulmonary dysplasia, or increase in mortality. And so what's interesting is that 36% of the patient population that they recruited had uroplasma, especially if they were more premature. This number went up to around almost 50%. And so their finding is actually intriguing in the sense that they found that the infants who were treated with azithromycin had less of a mortality and less of a chance of developing BPD. And so certainly I think this opens up a new area of research and how to think about early childhood exposure to microbiome infections and how that leads to chronic lung infection in these kids when they grow older. They looked at sort of 6 months, 1 years of age, and it's kind of significant. I think certainly right now more studies need to be done to see if we can move from their observation into clinical practice. One of the questions is, do we always test patients, the mothers in this case, uroplasma or other mycoplasma infections that could lead to more childhood exposures and infections and long-term consequences in lung diseases? And so I think more studies need to be done. I think this is certainly a great start to think about how to decrease these chronic inflammatory responses that some of the kids have. I think this highlights the fact that we need to think about both the organism, the lung itself, and then also the environment and how that leads towards lung health. And I think that places like in this ERS, European Society Conference, actually builds upon these kind of ideas, thinking about how these kids, as they grow older, becoming adult, contributing to their lung diseases. And so I think it's quite encouraging, and I'm certainly looking forward to more of these studies in the future.